Thank you, Faizana. Thank you. Thank you for kind introduction. So I hope, hi everyone. It's been, 68 participants. Good going, I feel, on a weekend day. So just give me a couple of minutes. I'll just share my slides. Yeah. Are my slides visible?
Uh,
కొంచెం వెనక్కి
no,
రండి.
as of now, sir.
No? Couple of minutes. I'm getting.
Sure. Once again, hello everybody.
PowerPoint presentation. Yeah. Share. Yeah.
Hi Nilendra, hi Ishwar. Yes, doctor, we can see your screen now.
Yeah. Done. Yeah. Yes. I think we are ready to go.
Sure.
Myself, Dr. Sishibhushan. Then, as ma'am told, I'm an interventional pulmonologist. Now, today's topic would be on health awareness regarding smoking, and the session objectives would be like this. So, we'll know all about tobacco today, various forms and its potential risks. If time permits, yes, few psychotropic drugs and what are other substance abuses. And along with that, I would love to take questionnaire more on snoring, sleep, and other pattern disturbances. So that's how we'll do it. So for 20 minutes, we'll just run through the slides. Then I would like to welcome all the questions, irrespective of the topic. Also, you can just come out with your questions. We can just go through. So are we ready to go then? Yes. Am I audible?
Yes, doctor, please go ahead.
Yes, yeah. So here we are. So this is the main topic. This is the pandemic which is going on now. Mark my words. This is the pandemic I am telling you, not an infectious diseases, but none less to an infectious diseases now. So this is what it is. It is all about tobacco for another 10-15 minutes. Just let's go through it. So this is the most common substance abuse in India. 21% of the Indian population do consume tobacco in various forms, and it is highly addictive substance when compared to other substances also like heroin, cocaine, all such things. It is equally addictive as compared to other substances also, and there is no safe level of exposure, and you all know this. So these are the different forms of tobacco what we are seeing: khaini, gutka, pan masala, zarda, name it what. But these are the most harmful substances in our life daily. Despite knowing they are harmful, despite knowing that they cause multiple effects on our body, still we are doing it, still we are consuming, still we are addictive. Then we'll come to know why. What is that so speciality about tobacco which is making us this way, right? So these are few statistics I just wanted to bring to your notice. See, almost 14% of Indian population, adult population, are smokers. There are two forms of tobacco smoking. One is a smokeless form of tobacco. The other one is a smoke, which I would like to tell you in another next couple of slides. But 25.9% use smokeless tobacco forms and 5% both. So almost around 40 to 45% of Indian population are consuming tobacco. So quite a large number, and irrespective of the gender, both male and female. These statistics are not for males. These are also for both males and females. These are the statistics, and these are 2010 studies. Maybe the recent guidelines are telling it is somewhere around 57%. So there is a hike in percentage of usage also. So see, this is what I was labeling. Why we called pandemic is just because of the surge in the number of the cases of 2000 from 2010, which was around 40% to 57% to 2026. So I think everybody has to take a serious note on this regarding the upcoming pandemic of tobacco use. So as I told you, these are the statistics. Greater than 15 years in Indian population, 28.6%, quite a huge population. And we could see the age, lesser the age, people are getting more addicted. This is the other problem. Initially, it was only the adults. Now it is the teens and the adolescents who are also getting addicted here. Among them, 28%, quite a considerable figure out of 140 population billion. So, of all such a population, whatever I am speaking about, of the entire population, 90 to 95% of the people know the harmful effects of tobacco consumption, despite which they do consume. Then what is it making? Why the people are unable to come over it? We'll just know. So the what are the chemicals in the tobacco? So this is what I was telling about. Raw and processed tobacco as used in smokeless forms, more than 2500 chemical constituents which are harmful. Of them, predominantly few are carcinogenic, few affect blood vessels, few affect heart, few affect lungs. So various, name a organ where the tobacco doesn't penetrate and doesn't harm. So it is like that. So 2500 chemical constituents in combustion, like more than 400 chemicals, out of which 28 are known carcinogens. That means 28 of all these things, chemical constituents, 28 are very harmful, causing cancers. So that is the risk burden among it. How are we using in tobacco? So I have told you the burden of tobacco use. Now we are seeing how the tobacco is being used in India. So it is like in the form of BD, hookah, smoking, reverse smoking, chewing, eating, pan masala, gutka. I think I have come down with few names only. Maybe the unique names at various places are so different. So this is how this is in the market with various names. Okay. This is the other slide is tobacco use harmful. So anybody, what do you feel regarding this? Hello, am I audible?
But that's all right.
Am I with?
Doctor, you're absolutely audible.
Yes, good going then. Yeah.
Just 1 minute. I would request the audience to be as engaging as you can. Just a small request. That's all. Please, doctor, continue.
Yes, I'm not gonna bore you for longer time on a weekend day. It could be a short briefing thing, which would be very useful also. Yeah, yes. Is tobacco use harmful or not? Yes, I feel it is harmful. Rather than it is harmful, it is taken as a medical illness now. That is why I have labeled it as a pandemic in the earlier slides. Okay. So this is a type of smoking where reverse smoking. This is a form where peculiarly we see in few districts of Andhra Pradesh and few communities in Goa, where the burnt end which is exposed to the environment, they put it in their mouth and they inhale it. That is how they smoke. That is the level of smoking how the people have gone through. So this just as a point of interesting point, I just wanted you to bring to your notice. Even people do smoke in such a way. So here is what I have told you. Smoking form of tobacco, smokeless form of tobacco, just these are various names, but how you take, so it depends. So based on that, these are BD, cigarettes, hookah, chutta, these all the smoking things. Smoke like things are like misri, kaini, gutka, where you chew. Predominantly these are in the powder form and you tend to chew a lot. And e-cigarettes is also a type of smoking only, smoking form of tobacco. So where the electronic devices through which you tend to smoke, but even it is equivalently harmful as you take cigarettes or BDs, whatever it is, the disease causing potential is the same, whether it is a e-cigarette, whether it is a BD, whether it is a hookah, whatever it is. But the various forms, how do you take it? How do you take it into the body? That determines the diseases, how you are affected with tobacco. So I think you are very famous. You all know what am I trying to tell you. So these are the things: smoking forms and smokeless forms of tobacco, various products available in the market. So this is the slide where all type of tobacco is harmful, use is harmful, irrespective. I mean smoking form and smokeless form. Whether you chew tobacco or you smoke tobacco, both are harmful. So don't undermine one over the other. That smoking with a filter will cause less effects. Causing chewing will cause more effects. Yes, there are few differences, but in any form you consume tobacco, it is harmful. So as I told you earlier, side those are around 400 chemicals and 300 chemicals causing carcinogens in various forms, in smoking and smokeless forms. So this is the question. This is the regularly what we ask in the OPD. Is just tobacco is just a habit or something beyond a habit? So most of us say it is a habit, but what medical fraternity is nowadays recognizing it is a medical illness. It is not a habit no longer. It is a medical illness. That is why I have labeled it as a pandemic. Why am I stressing on pandemic? Pandemic is because it is need of the hour. People are the percentage of people who are addicted to the substance is more, and maybe the incidence would be much more in the coming years. So you need to be aware of what we are taking. So it is no longer a habit. Please take it. It is a medical disease. So yes, Faizana, can we have a poll here? Hello, am I audible? Yes, Ankit. Yeah, Faizana, are you there?
Yes, sir, absolutely.
So shall we have a poll?
Sure,
Let us
sure,
interact with our people.
sure.
What do
Here
we
it
think
goes.
now? Yes, can anybody answer this? Please, I would like everyone to participate in it. I could see a question from Ishwar Singh. In history, who is started tobacco? Is there any history for that? Yes, it's long back. The story comes from, if I could recall and if I am correct, I stand correct also. From 16th century, it started in various forms and it entered into the country in various forms. I would like to share that video also. Yes, history is quite interesting. It has played its role in even freedom struggle of India also. So initially it was a choice which was inherited from the British people. Then it came to the poorer society. That's how the people got addicted to it. So it is from ages the history of tobacco is ongoing. Yes. So how about this? There is no known safe limit for tobacco use. What do you feel? How are my hello? Yes. Why is it not banned? So the couple of things, the government policies, they have been tightening the policies, but the implementation part is defective. Every time we have a discussion with the higher officials regarding the same, implementation is none. So that is why there is a lot of why it is not banned is because of these things, lack of implementation. But depending on the government to ban it, to make the law stringent, why don't we stop quitting? Even that can stop their sales, no? So that is the other way I think now we have to think, and that is the pure essence of the talk today. Uh, because in our scripture don't mention. Yeah, it is not mentioned as tobacco, but in various forms, in various states, it is known with different names. It is like that. So, how about the poll, ma'am? Are the audience interested? Are they polling?
Okay, so we got 83% votes for fact and 17% votes as the myth. Here we go.
There is no known safe limit for tobacco use. Yes. Is it a fact or a myth? See, very astonishingly, even people, I got both the answers. Huh? So let's discuss how is it safe and how is it not myth. Okay, it's a fact. Okay, so let's move on with that. So how do we see cigarette? So this is what it is. It is a pinch of tobacco rolled in a paper with fire at one end and the fuel at the other end. That is what the government has told us. It is not we who has framed that. Government recognizes that, despite which the laws are not very stringent to curtail the sales of it. So with this, I just wanted to emphasize, see what are the chemicals that with one cigarette you are taking inside. Your filter has a methanol which is used in a rocket fuel. Just before that, where you have socket, where the drug is there, where the tobacco is loaded, where you have an acetic acid, where the nicotine is there, it is used as an insecticide in the past. Where the paper, whatever it is there, it is a toluene, which is an industrial solvent and it is a carcinogenic, it can cause cancer. Whereas other products like butane, hexane, stearic acid, ammonia, benzene, arsenic, label them. These are the harmful chemicals with every day in, with every cigarette you are taking inside and causing your body and subjecting it to, you yourself are subjecting for the diseases process. So these are the harmful chemicals in each part of the cigarette. Whatever you have, I have just brought it to you. It's not moving. Yeah. Why do people take tobacco? This is $1 million question. So the answer came out to be, there is a product, something called nicotine in tobacco, which is the most addictive substance. That is why once they take it, they get addicted to it and they feel like taking it more and more. So in any form, smoked tobacco form or smokeless tobacco form, it is the nicotine which is the addictive substance. Why is nicotine so addictive and what it makes you to take it repeatedly are these factors. Nicotine makes you feel good, it gives you good pleasure, improved task performance, anxiety relief, enhanced vigilance, arousal. These are the things which nicotine really does. Then what if you don't take a nicotine? What does it make you? Craving. It makes you feel, please take me. Then it makes you irritable. It makes you anxiety. It makes you restless and many more things. So this is the main culprit in the tobacco for addictive substance. So the other part is passive smoking also harmful? Is the other question where we regularly see in the OPD. Passive smoking is, you are standing beside a person, you are somebody is smoking and you are inhaling that smoke. So the other person who is not smoking is called a passive smoker. So to label you, that if somebody asks you that you are a smoker or not, you cannot deny that you are not a smoker. Because if you are not an active smoker, then you could also be a passive smoker in this manner. Okay. So even passive smoking will also cause 30% of the infections. And all the risk factor, out of the 100% where active smoker has an infections or other medical illness, out of which passive smoking, even you tend to even harbor 30% of the diseases just by standing beside a person who is smoking. So these are the, don't think that you are not a smoker. So with this slide, I just wanted to emphasize the same thing. Even though you don't have any habit, you can be a passive smoker too. So these are the few risks from tobacco, what we see. So tobacco increases more of respiratory infections. In respiratory infections, where we see more of asthma, COPD, emphysema, where we every day see in the movie theaters, Mukesh, where it has been beautifully portrayed and pictured. He says that he has emphysema and chronic bronchitis just because of cigarette smoking. It is the same causes what we are highlighting here. So it can cause various other diseases like high blood pressure, diabetes, heart strokes, early heart strokes, not heart strokes, early heart strokes, early brain strokes, other valvular diseases of the heart. Especially more people know that cigarette smoking causes cancer. Does it really cause cancer the moment you smoke or in the long term is the next question. It is in the long run where you tend to develop smoking. What is the difference between COPD and asthma? Yes, this is a good question. So both of them, we label them under a disease called obstructive airway disease. What is obstructive airway disease is, whenever there is a bronchospasm, whenever the air passes through zones called as bronchi, bronchioles, these are all called conducting zones. Whenever there is a spasm in it, you tend to hear rhonchi and wheezing. So whenever patient has such clinical phenomena, then we tend to label them as an obstructive airway disease. In obstructive airway disease, there are two types. There are many types. Most common thing is, one is then asthma. The other one is a COPD. COPD is chronic obstructive pulmonary disease. Where the disease is continuous, where the disease is late onset, predominantly the cause is smoking. You never see a COPD in the young age except for few conditions. Alpha 1 antitrypsin deficiency, where which is not common in India, it is most common in abroad. So COPD, the onset of the disease is after 55 to 60 years. Asthma, you see a disease from the childhood and it is not continuous. This is the major difference between asthma and COPD. Asthma is only episodic. Whenever you are exposed to a trigger, you get an asthmatic attack. Whenever you are not exposed to a triggers, you are otherwise normal to a normal person. So asthma is episodic, COPD is continuous. Asthma can occur from childhood to any age. COPD occurs only in the later age, except in few conditions where alpha 1 trypsin deficiency is there. These are the predominant differences between asthma and COPD. Is COPD curable? Yes. COPD can be corrected. It depends upon the extent of the disease. Latest techniques, yes, we are doing these things. I'll tell you a couple of things. In COPD, the latest management tells yes, medical management is continuous. You need to be on your inhalers. You need to be vaccinated properly. You need to undergo pulmonary rehab continuously. These are essential credentials to curtail the disease at its stage. So whenever you don't do all such things, then the disease progresses. When the disease progresses, the alternatives nowadays, what we do is something called CT mapping, where we grade the disease quantity on a CT scan. Then we tend to decide what area of the COPD where the damage is more, then we tend to remove that part through surgical corrections. So those are the latest things what we are doing medically. Yes, to straight away tell it is curable, I would say this way, rather than to tell it is curable, it can be controllable with medications, with vaccinations, as I told you, with inhalers, vaccinations, and pulmonary rehab. These form a major constitution where it can be controlled, I feel. So progression can be curtailed rather than curable. Uh, yes, Vivek. Yes, Vivek Mathur. Is it fine? I think I have cleared. Yes, thank you. Yeah, we shall move on. So these are it. Even regarding the risks from tobacco, even miscarriages, preterm labor, low birth weights. Yes, this is what I was telling. Even the female population where we see more amount of smokers. So these are the things what we are seeing during the pregnancy time. So you have lot of miscarriages, premature labors, low birth weights. Yes, these are the common things what we are seeing, and they have been proved also. So this is the risk factor what I am telling about tobacco and cancers. This is the huge topic, a huge row is going on this. These are the various types of the cancers whatever we are seeing. I think I'm so liberal that I have labeled, and the person who has prepared the slides are so liberal that they have put only few names here. So there is no part in the body that tobacco leaves, and there is no part that cannot develop a cancer. So it is that way. So lung, oral cavity, larynx, pharynx, esophagus, stomach, liver, every organ is affected. Tobacco can cause cancer in every organ, and the risk factor is also proven. So these are the few lines what I wanted you to understand. Cancer is not a bolt from the blue, as I told you. All of a sudden it has occurred. No, it is your habit. I say it is your medical illness which has brought you here. So that smoking for a long period of time you are here is not. And the other fact, cancer is not a matter of fate. Yes, because you have invited it through tobacco, so you cannot leave it on fate. Cancer often is brought upon ourselves by our lifestyle choices. Yes, this is the reason what we are telling nowadays. Anybody who has labeled, the next question is, are you a smoker? Are you an alcoholic? And what is your lifestyle? So nowadays the cancer is more like a lifestyle disorders. So this is the pictorial form what I wanted to show you. These are the oral lesions. One here on the right, second image which is white. This is full blown oral cancer. Chewing tobacco has led that. First one is an oral ulcers. The second one is a full-fledged oral cancer. The third one is a stomatitis developing into cancer. Fourth one is also a developed into a cancer. What I wanted to understand you from this slide is whenever you develop a oral ulcers, please do not neglect because they can be potential carcinogens. Very recently, 3 days ago, I saw a case. where the person was suffering from the oral ulcers, thought it could be just because of his kiny eating, and that is a irritating thing. Though the causative organic factor was true, but the person thought it has to be, it is very light on lighter end. Then whenever we removed a biopsy, it turned out to be carcinogen. So please, whenever you have a oral ulcers, these are the various forms. These are the milder to the higher end of presentations. Please do remember. So this is what it is, COPD. What I told you, it is difficult in breathing is one of the symptom. Progressive disease, because we can only halt the progression for few years, but you cannot totally control the disease as on today. But the trials are ongoing to curtail the disease. But as on today, there are no such trial which has told yes, you can completely cure a COPD. So why COPD we are telling more is because apart from the accidents, apart from the strokes, hemorrhages, brain strokes, heart strokes, this is the second leading cause of death worldwide. So that is the burden of the smoking, and that is the burden of the deaths, whatever we are seeing. That is why we are telling smoking is no longer a habit. It is a medical illness. It is a pandemic where everybody has to understand the intensity of it. So this is what it is internally, how a lung undergoes all the changes. See, you can extremely onto your left, you can see the lumen. The next picture, you can see the lumen which is in red and blue, which is narrowed. This is what over a period of time your smoking does in the lungs. This is the microscopic picture. Whenever this picture develops, you tend to develop bronchitis, then you land up in emphysema. This is how the disease progresses. So tobacco and cancers, just now I have told you. So out of 28% of the smokers are developing cancers. Though UK data it is there, it has been almost more or less same in India, but onto the higher end. Passive smoking is linked to cancer. Yes, we have seen cases where passive smokers are also developing cancers. Those cancers where we see more with the people who are active smokers. So that is why we are also telling even passive smoking is also dangerous. So, so these are few other effects of tobacco chewing. So it doesn't end up at staining only. See, all you can see second figure showing gingival hypertrophy. Third one, all the kiny regular ura. Fourth, full blown cancer. So these are few other effects of the tobacco chewing where we call them as smokeless form. So these are other few pictures where it is the same. Few people they develop in their lips, where the other people they develop in the tongue. Few people they feel, third figure shows difficulty in opening the jaw, where they develop a submucosal fibrosis where they cannot open jaw. Ultimately they develop into, then the next stage would be the malignancy. Then they turn up into the cancers. So this is how a healthy lung and a smoker's lung look. So it is very clear, all the blackish color, whatever you have gone, it is not the paint which we have done. It is the tar from the cigarette and the other carcinogens and other the chemicals which are deposited over the lung over the period of time with smoking, which has caused this color and which has changed the echo texture of the lung. And see how the anatomically also how it is different. So this is how a lung looks, healthy lung versus a smoker lung. So this is how a second-hand smoke, as I told you. So even it is also harmful. Second-hand smoke means you smoke today in a, this is more important for you people, I guess, because you have a smoking zones where you smoke and go. But all that smoke gets deposited in that room in various particles. From there also even the person can inhale that, and that is called as a second-hand smoking. And it is also equivalently dangerous. Even it can cause many of the lung infections, throat infections, and lung cancer risk is also increasing. So passive smoking, second-hand smoking are also dangerous, equally dangerous. So why should I treat tobacco use? This is how why I should be more vigilant about tobacco. See, 1 in 5 deaths are because of smoking. 1 in 3 cancers are because of smoking. 70% of the smokers want to quit, but only 3% succeed in it. Why? I'll let you know in the subsequent slides. So this is the slide where I wanted to tell you, emphasize you, it is causing death. And people, despite knowing that, they are still getting addicted to it and feel there is no treatment for them to come out of it. So why should you stop smoking? You just see how your health is improved the moment you stop. Just before just you stop smoking immediately after 20 minutes, your heart rate and blood pressure drops. That means it is in a hypertensive patients where people are diagnosed with hypertension. That means they have been labeled with BP. Then after when they quit smoking, automatically their heart rate and blood pressure drops by 2 to 3%. That is the study, whatever it is telling, just by stopping a single cigarette for a day. Then for if you stop it for 1 year, then of risk of your coronary, risk of your heart diseases will come down significantly. If you stop smoking for 12 hours, carbon dioxide levels, which is carcinogenic also, it immediately drops in the blood within 12 hours. It is seen in most people even 14 hours also. 2 to 12 weeks if you stop, it improves circulation. That means the detoxing, already the lung is taking all its effect. The circulation is doing what effort it has to do it. So circulation improves, your lung function improves. If it is for 5 to 15 years, if you stop it, then your reduction in strokes is significantly less. For 15 years, similar status. The more you stop it, the more time, then less are the chances of the diseases. For 1 to 9 months, you stop it, coughing and breathlessness would decrease. Yes, this is an evident fact. Very recently, we are seeing many of the people are coming with shortness of the breath, breathlessness, pain, hacking cough. It is only because of the smoking. The only evident treatment is you just need to stop smoking. So these are the immediate to long term effects. Whatever we are seeing, if you can stop it. If someone stops smoking, does the star gets removed from lungs down the lane in some years or it doesn't? Is the star visible in X-ray? Is it visible in X-ray or CT scan? No, it is not visible. Uh, Whatever we have seen, it is through the thoracoscopy or bronchoscopy. It is through the thoracoscopic image, whatever we have seen. It is equivalent to whatever we do endoscopy. No? We put a camera onto the distal end and put it in our stomach. Similarly, we put a camera into the chest cavity. Then we have got those figures. It is not visualized on CT and X-ray. Will it be removed? Yes. In early stages, studies told 2 to 4 years of smoking. If the patient's years exposure to smoking is only 2 to 4 years, it can be reversible. Beyond that, it is questionable. So yes, I think I have answered yours. Thank you. So these are the immediate effects to long-term effects of smoking. That is why we are urging you to stop smoking. These are the immediate benefits what you see. Lot many benefits. So is it possible to get help for leaving tobacco? This is the major question what we are facing, and people have a lot of myths here. Is it fact or not? So yes, there are a lot of treatments available. Both medicines and counselings, both are available and both are equally important to quit smoking. Ma'am, shall we have a poll here? Or any questions are most welcome.
So here we go.
Yes, I think rather than spending a lot of money with the dermatologist, with my colleagues, so this is the question.
Well, I would request everybody to answer the query because we would expect the maximum engagement in the session.
My answer would be for this: tobacco damages the skin and causes a person to age rapidly. Yes, it's a fact. So it causes more whenever in the skin you see a person who smokes and who doesn't smoke, and who doesn't smoke looks more handsome, is just because of this. This is the only reason what we are saying. Because the whatever the yes, does Nicotex help in quitting smoking? Yes. In another 2 to 3 slides, I would come there and I will answer you, Ravi. Will it be okay? Yeah. If anyone has a question, please post them. Yeah, done. In another 5 minutes, we would come to Nicotex, right? Yeah. Yes, it is a fact. Whatever the answer for this is fact. Ma'am, we'll run through slides. Yes. This is the beautiful question. The difference between why, but nicotix is also nicotine which causes cancer, right? Yes. Nicotix has also has a cancer, but the only difference between a nicotine or any form of a tobacco and a nicotix is we have removed all those 4,000 sort of chemicals, all those carcinogens which have been removed, and it is the only nicotine levels only as a placebo we are giving. So all the chemicals which are harmful has been removed and that has been prepared as a nicotix. That is the basic difference. Kuldeep, is it okay? But nicotix is. Did I answer you, Kuldeep? Are you there with me? No. Nicotix doesn't cause cancer. Nicotix doesn't cause cancer. Yeah.
Also, just a second, doctor. There's one thing I would like to tell to our attendees that if you're really liking whatever we are doing for you, you can just make a post on Instagram tagging Ethika's page, and we will post it back tagging you.
Yes. Yeah. We'll go through. Yes.
So here we have.
So where to take a help? Here we are. Yes. It is a fact. Lovely to see majority are agreeing because it is a fact. So where do we get help? It is with the psychiatrist. It is here where presently I am, and we have established a tobacco cessation center, helping a lot of people to in withdrawal symptoms to come out of this hazardous upcoming pandemic. And this is my domain, and where this is how all the people are engaged: psychiatrists, dentists, ENT, pulmonologist. Lot many people are involved in tobacco cessation. Yes, we have established a clinic where we are doing. You can definitely seek out a help from here. Yes, this is what I was telling about tobacco cessation services. Yeah, medical services and psychiatric part where counseling sessions are we are establishing here. So that is all together. That is how we set up a tobacco cessation unit along with the medications. So lot many people work. Yes, what is the safest way to take nicotine if people smoke for nicotine? Is there center available in Mumbai? Yes, there is a center in Mumbai and Pune. Exactly, I don't recall the name of the centers, but there are tobacco cessation centers in Mumbai and Pune. Yes, they are there. Across the India, there are around 26 centers which have been recognized by central government. Even private practitioners are also doing nowadays tobacco cessation things. You can even follow up with them. Where to follow? Predominantly a pulmonologist and a psychiatrist would solve the purpose. Please, yeah. So, what is the safest way to take nicotine if people smoke for nicotine? There is no safest way at all to smoke for nicotine. Absolutely, there is no safest way. So, in the part of tobacco session, these are all the people where provider is from the doctor's end, whomsoever, let it be a pulmonologist or a psychiatrist. You need to have a very tight family support, co-worker support, friend support from the community. You need to have a support, TV, radios, whatever are the mediums where we are giving the health education things, magazines, faith, community, whatsoever it is. So these are all the people who should be engaged to make the society free of tobacco. So this is the community role, what we all social responsibility, what we have, all of us have. How dangerous is passive smoking? When say I'll compare it to the active smoking and tell it is 30% as dangerous as active smoking. Ankit, am I clear? How dangerous is passive smoking is? It is equally dangerous, 30% compared to active smoking. So these are the common myths. What people say every day, what we encounter: chewing tobacco is safer than smoking. So that is how the gutka and pan masala, they have rampantly increased their sales. I can quit at any time and I am not addict. Every person in the world tells the same. At any point, I can quit. This is the commonest thing. It is all about my willpower. No longer it is about willpower. Yes, I do agree the component of willpower has to be there, but the substance doesn't allow you to do that. Quitting is just a matter of willpower. As I told you, it is no longer that. If you can't quit the first time, I think it is very difficult for the multiple times to quit. The best way to quit is a cold turkey day. What we tell in this way is any day in a calendar, it is more important in your life. You take a decision of stopping it and you tend to do it. That is how Turkish people tried and succeeded in 4 to 5% of reducing their cigarette smoking. So that's how it is. So these are the common myths. Why we have posted these things are these are the common things every individual tells that it is my willpower. I am not addict. I can quit anytime. Chewing is safe. The other question is quitting is expensive. Absolutely no. The duration of treatment is 2 to 6 months. Hardly not many people, many of the people, 90% of the people tend to respond between 2 to 3 months only, where you don't even think about smoking again. And the cost of treatment, you would be surprising, it would start from 500 rupees, where it might end around 1500 to 2000 rupees per month. Not even a coffee when you have with your friends, that is the expense what you have. It is only your time and dedication and commitment what is lacking. Will you share recording? Missed first 15 minutes. Yes, I think team is looking into it. Yes, Sachin, that would team will look into it. I can't help patients smoke. This is how it is there. Effective. See, the first question is the doctor doing it or the intervention, whomsoever they have approached, are they ready to lend their hands for the for quitting? Or the next question is, are there any effective means to quit it? So that is what I was telling. There is a pharmacotherapy, there is a brief counseling sessions, and there are a few other things which needs to be taken care. So it is all together a multiple disciplinary approach where it has to be adopted for 2 to 3 months, where you can come out of this hazardous substance. So yes, it will be share. Heard something about herbal cigarettes. Are they safe? Can you explain? Absolutely no. Yes, this is a part of deviation. Very recently, everybody, yes, we are getting these things, but nowadays even it is adulterated with ganja, what we call regularly. So absolutely, there are nothing like herbal cigarettes. The concept was launched with other aspects where the people tend to take few of the things, all whatever kitchen substances, regularly spices we use, they are getting in the form of cigarette, in a form of powder, so that all the antioxidants released that could be reduced. That is the basic initial concept how they are trying to launch it, but it has been explored in the other way, where all the substances are kept in it in the name of a herbal cigarette. So definitely no. Not enough time is the other cause where people tell. So how much time you need is around 3 to 5 minutes. Whenever you visit a consultant, this is the only time what you need out of your 24 hours to quit smoking. If you are strong enough, if your will is strong enough, then the time required is only 3 minutes of your 24 hours. Vape versus smoke, absolutely it is as dangerous as smoking. Both cigarettes and vaping, both cause. Initially, the vaping was very highly regarded as it is safe, but no longer it is safe. All studies proved not even a single person less than a cigarette. Equally, they are causing harm. So, vaping and smoking both are injurious. So, what is the advice? What we say? So, any consultation, as I told you, if you can give your 3 minutes of time, what is the change that is happening? This is what it is happening. 30% of the people tend to quit. Can increase quit rates by your just 3 minutes of your time. So these are the ratios where we have seen, where the studies have shown also. Out of 30%, 7.9% they have withstained, they have abstained from the smoking also. So 3 minutes of your time, 30% quit rates we are seeing. So this is how what we are telling. So just your time is gonna increase the quit rate. So these are the few non-pharma. Is nicotine patches safe? Yes. That is a part of treatment what we are doing now in a part of de-addiction. Bhavika Rajpal. Yes, those are safe, ma'am. Those are safe. If quitted, then what are the chances of cancer? Hookah, vape, consumable once a week is okay. No, absolutely. In this regard, I would like to tell you, even a single smoke of cigarette over a long term, it has caused smokers hacks for 9 months continuous coughing. So even a single smoke of cigarette in your lifetime is also affecting your lungs, your throats. How far it is carcinogenic, not yet proved. But as I told you initially also, passive smoking, second-hand smoking, and single smokers. In this context also, I would like to tell you, who is a smoker by the way? What definition tells, what medical fraternity tells is who smokes 100 cigarettes in a lifetime is a smoker. That doesn't mean that you should smoke less, you will smoke only 80 and you will label as non-smoker. So it doesn't work like that. So whatever effects we are seeing, even with one cigarette or passive smoking exposed to second-hand smoking also, even the respiratory tract is so sensitive. Many of the respiratory disorders are with passive smoking, second-hand smoking, and active smoking. So even single cigarette can cause is the answer. If quitted, then what are the chances of cancer? As I told you, less than 5 years, less than 5 smokers, or more than 100 cigarettes. It depends on that way. If in your lifetime, if you have spoken less than 100 cigarettes, then probability of turning up into cancer is very less. If you have smoked more than 100 cigarettes in your lifetime, then the probability would increase. The factor which determines this, there is something called smoking index and a packed years. So how many pack of cigarettes you take in a day and for how long you have been taking this determines the cancer risk. In this, if the value is more than 200 to 300, then you are more likely 30 to 35% you are at risk of developing cancer. Hookah, vape consumption once a week is okay? No, it is not okay, man. So these are the various modalities of treatments available, non-pharmacological and psychosocial managements. So yeah, pharmacotherapy should be offered to all smokers trying to quit, except where contraindicated. Yes. So this is what we are talking about, smoking cessation, where all the things you can do, except in few conditions where whenever you have a brain stroke or recent heart attacks, then we don't tend to offer these. After 6 weeks of such events, we tend to offer such things. So this is the vicious circle. This would be a wonderful side. See, taking tobacco makes you feel good. You are euphoric. Likely then you will continue. Then not taking tobacco makes you feel miserable, withdrawal. Again you tend to take it. So this is the vicious cycle where you are trapped, for which regularly you tend to seek more tobacco. So these are the first line of drugs. So gums, patches, these are the nicotine replacement therapies in the form of patches, gums, lozenges, inhalers, nasal sprays. We don't have nasal sprays as on today in India. We have patches and gums and lozenges also. So this is how, as I told you, the difference between nicotine, even these substances contain nicotine, mind you. But how is it different from the nicotine, whatever is there in the cigarette is, it is a refined form where all the chemicals and all the carcinogens have been removed and the form is applied here and the drug is applied. So that is the basic difference what you have to keep in mind. So this is how what we do regularly, nicotine patches. This slide shows you how the moment you take cigarettes, patches, gums, how the nicotine levels vary. So these are the daily medications. See, the cost is very less per the amount of money you spend on purchasing cigarettes is more than you spend on a doctor in curtailing the habit. So this is the 5 A's approach. You ask, you advise, you assess, you assist, and you arrange. All these things are for those people. This is how the hierarchy, how the people we take you into, and we assist you in help in quitting. And there are few websites where they post all their experiences, how they quit, what are their experiences, what are their withdrawal symptoms. Then the next question comes, then how do I approach a people who are not willing to quit? Then this is called 5R approach, where you have a relevance, rewards, risks, roadblocks, and reputations. Under these things, we treat those people and we convince them and try to pull them out of this nicotine hazard. So these are, hello everybody, whether it's mother. Yeah. So these are the withdrawal symptoms. What we see: anxiety, irritability, poor concentration, restlessness, craving, headaches, drowsiness, depression, hunger. These are the factors which makes you to take nicotine again and again. So this is the myth. Whatever is happening, whenever I stop smoking, I tend to develop all such things. So this is a myth, no longer an accepted fact. Whenever you are in a rightful hands. So this is how you develop a stage of addiction. Initially, how does you go into a stage of addiction is, at very young age you tend to experiment with the nicotine in any form, gutka, rajgan, in any form, smoking, bd, cigarette, pan masala, you tend to experiment with it. Then you tend to be a social user along with your friends and colleagues. Once you are a social user at any point of time, very soon, within 6 months to 2 years, then you will be a regular user. Once you are a regular user, your nicotine will never leave you. Then you land up in a stage of addiction. Then progressively, you cannot stop it after 3 years. This is the vicious circle. Unknowingly, you tend to fall into this trap. You just experiment, social use, regular use, then addict, and it is difficult task from there. So identifying dependence, yes. How do from withdrawal symptoms is one aspect. The other one is whatever I have told you. Addiction is other aspect. Dependence is the other aspect. Dependence is with the, see how many number of cigarettes you are taking to get this same amount of pleasure. With the time, you need to increase the cigarettes. That is called dependence. Maybe at your initial stage, to get this same pleasure and euphoria and all those things, you might have smoked 5 cigarettes. Maybe after 2 years, with that 5 cigarettes, you will not get the same effect as you initially has developed. You need to increase the quantity of these cigarettes to get the same effects. So that is called dependency. Over a period of time, maybe after 3 to 4 years, then you tend to get into dependent manner where it is very difficult at this stage to come out of it. So tobacco difference, yes, this is what I was talking. Why you depend? Because stress is the reason, craving is the other reason, tolerance I told you, withdrawal symptoms, difficult to control, harmful substances. So these all factors make you more dependent on the drug. I mean on the nicotine. So that is how it is there. So few things where I would like to tell you some common withdrawal symptoms and how do we just cope up with them is this way. Irritability, then take a walk. What about the environmental pollution? Can somebody get asthma, COPD, cancer due to that also? I heard somewhere that pollution nowadays equal to smoking. Yes, that is a fact. Pollution, yes. What are pollutants? In whatever are the form we are inhaling the pollutants, that will cause chronic inflammation in your lungs, and that is the trigger and the earlier point for developing COPD or cancers. So chronic exposure to all the pollution will also cause cancers, established fact, and more amount of lung cancers are also we are seeing because of that. So how do you commonly, okay, how do you commonly cope up with these symptoms? So this is how it is. So whenever you have a cough, drink plenty of fluids. Whenever there is a dizziness, whenever you are sleeping, because these are all nicotine dependent things what you can do regularly. So apart from the medical treatment, these are the few take home remedies what you can do just to distract yourself. Okay, these are the This is the same 5A approach and 5R approach, whatever I have told you initially. So this is the story what I told you. How nicotine in India. Initially, it is this way. Whatever. So behavior treatments, whatever are available in 1970s, it is only with the psychosocial counseling we used to do it. Then 80s is the era where we have gums, but the awareness is pretty less. In 2000 is this wonderful drug bupropion, what we see to use air filters in home. Yes, this is a valid question, ma'am. I would like to tell it is good to have because pollution is categorized into two types, indoor and outdoor pollution. Indoor pollutions can be controlled with these air filters, whatever is there. To some extent, even it is curtailing the outdoor pollutions also. It is good and effective to use air filters at home. So it is this 2000, in 2000 we developed this bupropion wonderful drug where it has revolutionized the treatment part. Then this is also a magical drug wherein we clean in 2006 we have developed. It is all for the dependence treatment. This is how the treatment has evolved from 1970s to as on today. So this is the other thing, tobacco cessation in special situations. What are the special situations? It is one is a pregnant and lactating female. The other one is existing cardiovascular diseases. The others are people with mental illness, other substance abuses and other side effects of the tobacco. So these are the situations where conventionally you cannot treat such patients because you need to treat the underlying disease and the causing agent also. So this is what I was trying to tell you. Only 30% try to quit every year. Only 3% succeed in it. Why? Because they tend to go into dependence. What is dependence? It is a chronic condition. That means it has been running for longer period of time, for more than 3 months to 6 months. And frequently, the moment you stop quitting and some or the other there is a trigger, again you tend to take smoke. So frequent there are lapses and relapses. So that's why treating dependence is a very difficult task when compared to the comparing the withdrawal symptoms. So this is how we treat you. When you are addicted to the nicotine, then these three parts will come into play. One is a physical thing where you control your craving, tremors, all these symptoms, whatever physically we see, we tend to control. Then there would be a behavioral thing. Then there is a psychological thing where you tend to improve your through counselings, we tend to improve such factors. Then physically, these are the things, medications, whatever we are on today, what I have shown you in this slide. Behavioral things, as I told you, lifestyle changes, diet management, avoid smoking, all those groups, whatever to divert the things, whatever you need to do, you need to do. So this is the triangle, behavioral, physical and psychological things need to be assessed in planning whenever you are planning for smoking cessation. So this is the major slide. Please do concentrate on these things. Many things, many doubts might arise from this slide. There is a short-term management, as I was telling you, where you tend to have a lot of results within, which is called within 1 to 3 months. See, this is a symptom severity and this is time in months. Initially, the moment, here are a lot of myths where people tend to maybe lack of awareness or they don't understand here what is happening. That is why they deny treatment. So this is the initial 1 month of the phase. This is the second to third month of the phase. Okay, the moment initially you stop it, these are the initial symptoms what you see within 1 month: irritability, discomfort, anxiety, mood fluctuations, depression, poor sleep and constipation. This is only for hardly for 2 weeks to 4 weeks. Still, if you are on treatment, with treatment, these all things are addressed and these are all correctable things. So don't panic for these withdrawal symptoms. How much effective? So this is the long-term management. In these two aspects, we tend to manage greater than 3 months. As I told you, few subset of population, approximately around 8 to 10%, will require these long-term managements. After stopping the short-term management for 3 months, 2 to 3 months, then they develop cravings, increased appetite and weight gain, where you need to address these issues also after stopping smoking. So recently, May 31st is the No Tobacco Day celebrated across. And this is the theme, unmasking the appeal, countering nicotine and tobacco addictions. This is what we are doing. Please tighten the regulations. Please stop the availability of these things. This is the theme what we are working on this year. WHO has decided and it has been circulated across. And recently, I would like to bring to your notice, very recently, in collaboration with the Commissionerate of Cyberabad, we have conducted such health education initiatives on this because very nearby schools, not even less than 100 meters of distance, there are a lot of these pawn shops, cigarette smelling vendors, many of them. So there was a special drive conducted to remove all such things, which happened very recently in Hyderabad. So my concluding statements would be these things. Do not start it. As I told you, experiment is the first stage where from there you tend to get to the addiction. So whenever, please don't start it, don't experiment it. Occasional users, as I told you, social users, please stop it. Don't need to think of it. Regular users, yes, I told you we are there. Just commit yourself. We will help you out. So message would be stop smoking if you smoke. Don't allow anyone to smoke anywhere in or near your home. As I told you, passive smoking and second-hand smoking is also equivalently dangerous. Not allowing anyone smoke in your car, yes, and in your public spaces. That makes you social responsible also. Make your children's air smoke-free zone. Yes, smoking is also a pollutant where you are adding into the pollution. Think of your kids, further generations where they need even fresh air to breathe. So make your children air smoke. Yes, that's what I wanted to tell you. Teach your children to stay away from the second-hand smoke. So quit tobacco and choose your health. That's how it is. Thank you.
Thank you so much, sir. So we have some certain other queries in the Q&A section as well.
Definitely.
So here is somebody, an anonymous attendee, asking, is it very difficult even after Nicotex that I start craving more for it?
Yes, because it has to be the appropriate dose and it has to be evaluated. So what is the burden of the smoking? You have been exposed for X amount of years. For example, if you have been exposed for 5 years, the dose of the Nicotex, whatever we give, is not the same if you are being exposed for 10 years or for 2 years. So that is how the management part differs. So it is the exposure, it is the duration which determines the dosages, and the correct dosages will definitely will curtail all such symptoms, all such side effects also, all cravings also. You spoke about pulmonary rehabilitation for COPD. What is that? Pulmonary, what basically rehabilitation does is, there are two aspects in this, man. So what we call pulmonologist, what we say, life is breath. Just imagine the first thing you do when you are born is taking breath. The last thing what you do is also stopping breath, right? So in between whatever you are taking, the breath is life is because of this. So inspiration and expiration determines your lifespan. It is first thing. Second thing, COPD, whenever we are talking about rehabilitation, there are two aspects. As I primarily told you, COPD is an expirational disorder. The predominant problem is whenever the patient exhales his air. So that is the problem. Few diseases are there. In COVID, whatever we have seen, it is the problem in taking in of the air. That is inspirational problem. So we train in a pulmonary rehab. We tend to train with the exhalation. How to exhale is carbon dioxide, because the problem itself is in the exhalation. When there is a problem in the exhalation, the amount of CO2 which has to be released out into the environment is less. So that means it is accumulating in the lungs. The more the CO2 is accumulating in the lung, all the side effects of CO2 in the lungs, you tend to see. The value when it is more than 60, then you tend to become drowsy, then you tend to lose your consciousness. Then these are the effects. Then your myocardium stuns suddenly. These are the effects of having more CO2 in it. So in rehab, we tend to improve this exhalation through various techniques, and we tend to improve inhalation also. with few exercises. Along with that, there are something called toning exercises and grading exercises to the muscles, so that we build up your respiratory muscle strength to take that adequate breath and to exhale that adequate breath. This is what we do in rehab. So these are sort of exercises. Yes, these are sort of exercises where these exercises, how does they differ from the others, is only one thing. Few exercises are precisely to remove CO2 from your body. Few exercises are precisely to increase oxygen content in your lung. So that is what we do in a rehab. Vivek, am I clear? Understood. You can please suggest some centers for rehab near Delhi, NCR, or in Pune. Delhi, I am not sure. Pune rehabs, yes, you have in Bharati Vidyapit, Pune, where I have graduated from. So I can tell you. In Hyderabad, yes, you can come up to Legacy Hospital, where we have started our rehab center also, where we are doing all such things. Yes, I would like to take more questions. Anything on sleep, obesity, snoring? Yes, we will have much more talks on them, but I am ready to take questions on that also.
So somebody is asking, is nicotine patches safe?
Yes, that is what I am telling you. In a de-addiction, what we do, nicotine patch every day. We take a particular dose and we fix it. Nicotine patches are available in 21, 14 and 7 mg patches. So for every 2 to 3 weeks, we tend to decrease the dosages from 21 to 14, 14 to 7, depending upon the exposure. So that is how we tend to do it. So nicotine patches are safe, and it has to be combined with the withdrawal controlling medications. Then absolutely, then that would be very beneficial to you. How to stop snoring? How to stop snoring? I don't have obesity and do not smoke till I snore. Okay, this is a great question. So this is again a common myth. Only obese people snore. This is a common myth. The other common myth is I am tired, I do snore. This is the common myth. What we commonly tend, and this myth has been so into the market that it is very difficult to tell them it is wrong, because they are already preoccupied with that thought. So there is something called obstructive sleep apnea. The other one is obesity hypoventilation syndrome. The other one is central sleep apnea. The name itself is telling obesity. It is OSA, obstructive sleep apnea. So that means there is something in the airway which is obstructing it, and it is causing as a snoring. So what is basically snoring? The air which is going through your nose into the lungs. In this passage, there is an obstruction which is present as a snoring. So this is called obstructive sleep apnea. Few issues there are in the brain, like strokes. In such scenario, you tend to develop central sleep apnea. For central sleep apneas, where you also tend to have snoring, you don't need to be obese. You can be as lean as 40 kgs and develop snoring also. The other one is obesity hypoventilation syndrome, where when your BMI is more than 30 years, all your breathing passages tend to get choked and you tend to develop snoring. These are the common causes of snoring. I have DND. Do I snore? Do I snore because of that? It is deviated nasal septum. Do you mean DND? Yes. That is what I am telling you. All those things. What are the obstructions? Possible obstructions from your nose to the lungs. If I take the nostrils, it is the septum which can be deviated onto one side predominantly, and it can cause snoring, which is correctable cause of snoring. The moment you undergo septoplasty, they cut the excessive growth part, then all your passages are restored. Then you tend to then there will be no snoring. At times, even your adenoids, which are most commonly seen in pediatric population, where your child snores a lot, you tend to see within from 2 years to 7 to 10 years of age group, where your adenoids are nothing but other tonsils behind your nose. So even when they are also swollen, because of repeated viral infections, repeated cold, cough, fevers, they tend to get swollen. Repeated exposure causes more swollen, more hypertrophy from where the passages is obstructed. So for 7 years, you tend to eat and you tend to remove. Even adenoids, enlarged adenoids are also correctable causes of snoring. Even your tonsils will also cause obstruction. Even at times, removing tonsils will also clear snoring. Beyond that level, if there is a tumor which is pressing it, if it is a benign tumor, it has to be excised. Even that can cause, even that is a correctable cause of snoring. Apart from this, if there are any central causes that cannot be corrected, and the management would be different. Please do. Yeah. So Ravi, if yes, DNS is the cause for snoring and it is a correctable cause for snoring. So if the severity is more, please do undergo septoplasty surgery. That would help you out. Any more questions? Any generalized questions too?
I hope all the queries we received till now have been answered comprehensively.
I completed my DND surgery, but still I am snoring. Should I go for throat surgery? No, absolutely no. Then you need to undergo a staged nasal endoscopy, what we call you. Then we see where exactly is the obstruction and what is the level of obstruction. Then we will decide what is the level of management. There is something called, if there is an obstructed pathway, either it can be mechanically opened through a surgery, as I told you, adenoids, DNS, and tonsils. If such is not the scenario, if there are muscles, if your muscles are weak and you are undergoing and there is a collapse because of your weak muscles, then you need to strengthen your muscles. And if your anatomy, your jawline, your throat and nose alignment itself is not proper, even that can cause, small occlusions can also cause snoring. So it needs, not all smokers have a same cause, not all snoring has a same cause. So this is what you have to understand, because every snoring, individual people have their own cause why they are snoring. So that has to be individually seen. But yes, definitely, despite correction DNS, still you are snoring, you need to think of PAP therapy, CPAP or a BiPAP. Is there any relation between snoring and body weight? Yes, definitely yes. More body weight, more increase in the body weight, more BMI will cause more snoring. Just because I told you, the neck circumference in an obese people is more. Whenever the neck circumference is more, it tends to choke your respiratory passages. That is why you tend to snore more. So first parameter, whenever the person is obese, we ask him to reduce his weight such that the respiratory passages are not choked and there will be a easy passage of the air. 100% there is a relationship between a body weight and a snoring. More the body weight, more is the snoring, more is the level of obstruction.
So there is another query by Neil. Can we reduce snoring without any surgery but just by yoga or any exercise?
Yes, in this regard, as I told you, if there is a mechanical obstruction, as I told you, if there is a deviated nasal septum, if there are adenoid hypertrophies, if there are tonsillar hypertrophy, if there is any mass causing it, as such, there are no yogic exercises to reduce this. First thing, if it is only because of the collapse, if it is only because of the secretions, at times people tend to have lot of mucus secretions where they tend to have lot of snoring because of the obstruction. In these regard, clearing these mucus secretions, few yogic exercises are gonna help you out. But per se, as such, yogic exercises reducing snoring, it is a big challenge. Yes, I do agree. The question is coming from the famous ad, whatever we are seeing nowadays. Wonderful session within 6 hours, all my sleep apnea got reduced. So I think that is an advertisement. It has to be advertisement only. Absolutely, there is no truth in it. To some extent, it can help in clearing mucus, which is also a cause of causing snoring, but not 100%. Any more questions?
So I guess we have almost wrapped up and answered to each and every question very pretty much in detail. So I guess we are good to go. We are good to wrap up.
Then, any poll opinion on the lecture opinion from the audience? Anybody, could they post it? Any opinions? I think 29 still are available. Insightful. Thank you, Vivek. Thank you so much.
All right. So I guess we are good to wrap up. So we have finally come to the end of this session, and my heartfelt gratitude towards Dr. Shashi for such an insightful discussion. And we know that most of us are already aware that smoking and tobacco and vaping is pretty much harmful. But today's session helped us to have a deeper understanding to what extent the damage it can cause to our physical health. And it's also an important reminder as to why awareness and timely action does matter. So thank you so much, Dr. Shashi, for explaining these aspects so comprehensively and helping us recognize the importance of actually being informed. So, before we actually sign out, I would like to remind everyone as we spoke about the Legacy Multi Speciality Hospital, and they are offering free consultation, the first free consultation on 6 parameters. So, what are you waiting for? It could be helpful for you or your dependent. So, if there is anybody who could who could benefit it from them, you can just avail it through a portal. And once again, I would like to invite everybody to our WhatsApp community using the link I have shared, a space which is led by expert, and you can participate in meaningful conversation. So thank you so much, everyone, for joining us today. And Dr. Shashi, it was truly a wonderful session and pretty much knowledgeable. So once again, I will
Thank you.
just post it
Thank-
now.
Yeah, thank you. Looking forward for many more things in
Yeah.
coming days. Yes. Come up
Thank
with
you,
your
everyone.
topics. Here we are to clear your myths, to give you more insightful knowledge. You can come up your hardcore topics also. We are ready to discuss. So let the audience take their call and come up with the topics.
Thank you, Vivek. Thank you so much, everybody, for participating. Have a wonderful weekend ahead, and Doctor, you too. Please enjoy.
Thank you.
Yeah. Bye bye,
Yes,
everyone.
yeah, good weekend.